Start off with a little bit of a note for programming and future. As it stands right now, the plan is to continue these media sessions through this week, through the current lasting of the governor's stay-at-home order, and we will assess as we get towards the end of this week to move into future media sessions of either once a week or on an as-needed basis. We will make the public and all media aware of the frequency that we have future sessions towards the end of the week. So do be aware of that. We're going to start off with some opening statements from Dr. Silvernail and then open the floor for questions of Dr. Silvernail and then all of the participating municipal and community partners that we have virtually attending this media session as well. So we'll get started with Dr. Silvernail's comments.
Good morning, Pitt County. Happy Cinco de Mayo. Thank you to the people of Pitt County for hanging in there and following our guidance. Thank you to the staff of Pitt County Health Department for hanging tough in these difficult times. I've started referring to my staff as COVID warriors as I walk around and say hello to our folks. I want to present our county data mostly as graphs this morning. We have modeled our graphs in our data collection to follow the state graphs to allow for comparison. I'm not going to be showing the state graphs this morning, but I did want to show our graphs and show you our data at this time. The first graph Mike has up for me. This shows the Pitt County COVID cases by date of specimen collections. You can say the highest number on any date that we've received back is 7 cases. Most days, as I've said, we're somewhere between 1 and 4. There's also a fair number of 5s in there, but generally we're somewhere in that 1 to 4 cases per day on average, and that has been stable for more than a couple of weeks now. Next graph, Mike, or if you want to hand me the clicker. Thank you. This is what I finally refer to as the Amelia graph, my granddaughter's graph, but this again, as a line graph, shows our number of cases by date of specimen collection, and you can see that again, we're sort of in that 3 to 5 range, 2 to 4 range most days. The last couple of days on the graph, we're both 1 case per day on that graph. Next, this is our cumulative total of number of COVID-19 cases, again, by date of specimen collection. So we do go in and revise this on a daily basis. And again, as you get to the top of that graph, we're up to 141 cases as of this morning. And that curve appears to be sort of shouldering or flattening out. Again, it's a cumulative case curve, so the number is always going to go up, but it's the rate at which it goes up that's important, and that rate does appear to be slowing, which is encouraging. Next case, we had started calculating this back around the end of March. We actually had a few calculations before March 30th, which aren't shown, that show the upslope of the curve to around the 20% range. This is percent positive of total testing by date of return. So these are results that are available to us on any given day, and we calculate, or I calculate, the percent positive of this. As you can see, we're up around 20% from about March 30th through April 15th. And then we started a decline, which has been maintained. Little uptick yesterday from 9.4 to 9.8. But this morning when I ran the numbers, we were at 9.5. So kind of settling out just below 10% right now, which again is in my mind an encouraging thing, meaning that of the people who are being tested, about 1 in 10 or a little less than 1 in 10 is actually positive when they're tested. So again, I think that's an encouraging bit of data. And then the last graph, just to as a bar graph, show the total number of tests that we are aware of. Again, providers are not required to report when they test someone to us. So that is an estimate of the total number of tests that have been done. Then we have the negative tests right now, which we are at 1,350 negative tests. Our positive tests, 141. Our estimated recovered is at 93 as of yesterday afternoon. I'll recalculate that number later today. And then we've had the 2 deaths that we felt were COVID related. So again, I think Pitt County data continues to show some encouraging trends. When we look at the state cases, North Carolina as a state is at 12,256 cases compared to 141 in Pitt County. Our estimated recovery is at 93%, 93 cases, which represents about 66% of our confirmed cases. In North Carolina, there have been 452 deaths as of this morning. In Pitt County, we are stable at 2 deaths. Move on, and I'll talk about other public health issues this morning. Non-COVID-19 infections. Yes, there are infections out there besides COVID-19. Pitt County Health Department continues to monitor and implement control measures for non-COVID-19 related infections in Pitt County. These include things like rabies, pertussis, and tuberculosis as common examples. Fortunately, there are no other outbreaks at the time, but we do monitor for and implement control measures for a number of infectious diseases of public health concern. Chronic diseases. As most of you know, Pitt County and Eastern North Carolina in general have high rates of non-COVID-19 chronic disease. These conditions include things like diabetes, high blood pressure, asthma, chronic obstructive pulmonary disease or COPD, and other cardiovascular diseases such as heart attacks and strokes. Please make sure that you're managing your chronic health conditions during this epidemic. Please do not be afraid to seek emergent care for symptoms such as chest pain, shortness of breath, or sudden onset of weakness, numbness, and tingling, facial droop, or slurred speech, which might indicate a stroke. Stress. These are certainly stressful times. If stress is getting to you, please get some help. Consider talking to your spiritual leader, a trusted friend, a parent or grandparent, your siblings, and if this isn't enough, please seek the advice of a professional counselor. Finally, I would remind you to please go home and stay home. And I thank you for your time and attention this morning.
Hey, Dr. Silvernail, if you want to just stay there, we'll go ahead and jump right into the questions. We're going to go in the order that the media called in, starting with the Daily Reflector and Elizabeth Johnson. Do you have any questions for Dr. Silvernail?
Oh, yes, I do. Okay. So, hi, Dr. Silvernail. At many stores, it does not seem that the capacity limit is being enforced. Have you received any reports that this is a case, this is the actual case?
We have received complaints in the past regarding the large box stores. Again, I would remind you that enforcement is was within the jurisdiction of local law enforcement, not within the jurisdiction of the health department. But yes, people continue to complain about the big box stores in town as being well occupied, shall we say.
Okay. And some businesses are beginning to reopen. Do you know if they've applied for exemption?
We don't track who has exceptions to the governor's order. I know some businesses have applied and been successful, and some have applied and not been successful. So I would encourage all businesses to follow the law, which means adhering to the governor's order at this time.
Dr. Silvernail, if I may interject too, the information for that is on the coronavirus information page of our website and how to apply for that.
Okay.
All right, thank you. Have there been any healthcare workers that have contracted COVID in Greenville or Pitt County?
I believe there have been. We work with the institution to do contact tracing and make sure that exposures are tested.
And are you able to say which institutions there were healthcare workers that contracted COVID?
There have been several of them.
Okay. Do you know of any healthcare workers that contracted COVID at Vidant or in the Vidant system?
I believe there was at least one, but I don't speak for Vidant.
How many healthcare workers?
How many healthcare workers have contracted COVID in Pitt County?
I don't have a specific number for that this morning.
Okay. And Do you know of any nursing home cases?
We have had one case in one facility. We do have what the state would consider a defined outbreak in a second facility. The patient has been transferred to that institution's regional COVID center where they are cohorting COVID patients. She was asymptomatic. There were 2 workers at that facility that tested positive. They were also asymptomatic. The remaining residents have been tested, and so far all those tests have returned negative. I'm not sure if they've all returned, but the ones that have returned negative. The vast majority of staff in that facility have been tested, and so far the return tests have been negative with the remaining staff as well.
And how many people had contracted the virus at the facility that had a defined outbreak?
1 patient and 2 staff.
Oh, so just 3 is the defined outbreak. Okay.
Well, the state would define an outbreak as 2 or more patients, 2 or more staff members, or any combination of 2 or more staff and patients.
Okay. And I think that was my last question. Thank you.
Okay.
Moving on now, next to WITN, Clayton Bauman, if you have any questions for Dr. Silvernail.
Hey, Dr. Silvernail. Governor Cooper has a press conference planned for 5 p.m. Where he could give details on what phase 1 of reopening could be like at the end of the week. Is Eastern Carolina prepared to reopen? And what does a phase 1 for Pitt County look like to you?
Well, I can't speak for Eastern Carolina. I can speak for Pitt County that our data trends are favorable, and I think we could open. Our phase 1 would look like the governor's ordered phase 1. We could be more restrictive, but we could not be less restrictive than the governor's order.
Okay. And we've heard talk about a second wave of coronavirus coming. Some states are taking more aggressive actions with their reopening. Do you feel, is there a chance that we could be right back where we are now in several months' time?
Well, Clayton, honestly, I think our population has followed our guidelines and understands that this infection is going to take a while to work through our population. We understood right now without a vaccine that we could never prevent this from getting to more people, but it was making sure that the rate at which people acquired the infection was slow enough so that we didn't overwhelm our healthcare system. And, the good news is we were successful in doing that. Hopefully we will have a vaccine sometime by next year and be able to vaccinate amongst us. The other thing is that we realize the footprint of the disease in our community is larger than we can measure. And some early estimates suggest that may be 5 to 10 times what we can measure in terms of the asymptomatic or mildly symptomatic individuals in our community. And it's likely that some of those have some degree of immunity to the virus. As to a second wave, influenza is well known for having second waves. We don't know what's going to happen with coronavirus. I think that what I really expect is this is probably going to be more of a slow burn, and that there will be a slow rate of cases that will continue for some time until enough of us are immune that the virus can no longer be adequately transmitted. But I don't know that we'll see a second big wave. If we willy-nilly through, well, let's stop it and all go party together. Yeah, we could see a spike in cases. But I think what we would hope for is that this would be a slow burn.
Thank you so much, Doctor.
You're welcome.
All right. Next up, WNCT, Madison Forsey. Do you have any questions for Dr. Silvernail?
Hi, Dr. Silvernail. So yesterday I was listening in on the Pitt County Commissioners meeting, and there was a lot of discussion. The motion was ultimately struck down to ask the governor for independence to reopen Pitt County. And there have been movements like that across the East and other counties as well. Is that kind of fractured reopening from a healthcare perspective, is that a smart move in fighting this virus?
Well, I think we would always want kind of a unified approach. The The problem is we might need to look at this from a regional perspective. Eastern North Carolina is very different population wise from the Triangle or from Charlotte and Mecklenburg. So what's right for Mecklenburg may not be right for Eastern North Carolina. So yes, we should have a unified approach to reopening, but reopening in a very big urban area may not be the same reopening requirements for a more rural area like us.
So then if we did kind of have that fractured reopening, I guess what would be some of the drawbacks that we might see in our area?
Well, I guess it would be, movement of folks together, large group gatherings, things like that would be potential areas where we could see that spike in cases. So I know people are missing each other. People do want to interact with each other. So we probably do need some limitation on size of groups. What that number is exactly, it would be, I think any of the numbers that have been out there have been sort of a best guess number. But that's probably the biggest vulnerability we would have would be in bringing large groups together for festivals and things like that.
And Pitt County is definitely a leader within Eastern North Carolina. And as a health leader within Pitt County, does it worry you at all or scare you at all to think that there could be a second wave or any kind of hesitation or fear?
Oh, of course. I mean, my job is to help protect the health of our residents here in Pitt County. And I want to make the best decision possible for the residents of the county. This is a completely new infection, an infection which we've had about 5 months of experience with now. So I think we have to look at the data and make the best estimate on that data that we can. If you look at our county data, it compares well to the state data. There are similar trends in the state data. So I think that's encouraging from a state standpoint. With the other two coronaviruses, they sort of needed to run their course to a certain extent. So with SARS-1 and with MERS, they had to kind of burn themselves out. And I think eventually this one will burn itself out. Hopefully a good warm summer will help burn this out, pun intended. But yeah, that worries me. And obviously I want to help our elected leaders make the best decision they can for the people of Pitt County.
I think that's an interesting way to describe it, as a slow burn rather than a spike. But we see people that are protesting in Raleigh today. Like I already said, there are a lot of different county commissioner groups that are wanting to reopen things. Is there anything that you think people still don't understand about this virus that you could maybe help clarify to them about why it's important to social distance and maybe why it's important to keep these businesses closed for a little bit longer?
Mm-hmm. Well, Madison, I think, we do understand, at least in part, how this is transmitted in terms of respiratory droplets. So maintaining that physical separation. I was talking to one of my colleagues here in the county PIO office earlier, and we were standing 6 feet from each other. On a typical day, we would probably stand closer. So I think it's important to be mindful of that. That's probably the biggest thing, is this physical separation of people. And then the hygiene issues in terms of washing your hands when you've been out of the house, before you apply cosmetics, before you eat, before you touch your eyes, things like that. It's understanding how we interrupt that transmission. And then when we do get to a point where we reopen, making sure that we keep those transmission interrupters in place so as not to get that large spike or flare up of cases when things do reopen.
And I want to revisit earlier, the reporter from the Daily Reflector had asked a question about nursing homes, and you had said that there was what the state would define as an outbreak at a nursing home facility. I just want to clarify that's in Pitt County?
Yes, it is.
Okay. So then with that, how much communication, I guess, has the health department had with nursing home facilities within the area?
My staff checks with them every day. We're running down the test results. They have tested all the residents of the facility. They've tested the vast majority of their staff, and we will run those results down. Interestingly, the patient was asymptomatic, and the two staff members were both asymptomatic. They had positive testing, but no symptoms. So in part of me says, well, how can you call it an outbreak with no symptoms? But they clearly had positive tests and meet the criteria from the state standpoint to call this an outbreak. But as of yet, we found no sustained transmission in that facility.
Okay, I think that's all the questions that I had. Thank you.
You're welcome.
Okay, finally, we have WCTI, Tyler Harden. Do you have any questions for Dr. Silvernail?
Yes, good morning, Dr. Silvernail. Thank you for your time this morning. I wanted to see if you could kind of talk a little bit about the connection between COVID and seeing strokes in more younger people. And do you know if there's any patients that have had that as a symptom or an effect of COVID in Pitt County?
Tyler, if I implied there was a connection between COVID and strokes, I did not mean to do that. What I think we have seen is that some individuals may be afraid to seek care for what are emergent medical conditions because they're afraid of contracting COVID in the emergency department or another healthcare facility. There have been some reports of blood clot events, what we call thrombotic events in patients with COVID infections who are hospitalized, but any hospitalized patient has a risk for a blood clot event. But some of these have been a little atypical from what I understand. Again, I'm not doing the inpatient care for these individuals, but there's not a direct link between COVID itself and heart attacks or strokes that we're aware of. But what we're concerned of is that some people may not seek care for symptoms that at other times they would recognize as a potential heart attack or stroke, and go to the emergency room.
Got it. Do you have an update on the prevalence study that you all are working with ECU on?
Yes, we continue to meet with our partners at ECU and plan for this. They're working on the budget. They have the funding from the state, so they're working on the budget and the exact sampling strategy. We have begun some very preliminary outreach to groups to do the survey. There will likely be two parts to this. The first part is to do a survey with as many people as we can get to do that survey, and then from that survey to try and select a representative population or group of individuals from Pitt County who will complete additional surveys and undergo testing at some interval to look for infection and maybe immunity. We may do both collection for PCR testing for acute infections, as well as blood testing for serologic immunity.
Okay. And I see that, Walmart has set up a drive-through testing site in Pitt County. And are you all working with Walmart on that drive-through testing site? And could we see more of those kind of testing sites in the future for Pitt County?
We are working with the state health department and Walmart on that site. It was an interesting experience to get that up and running with a couple of starts and stops in there. That's why it was not as well publicized as we might have liked to have had. The state is footing the bill for that. The results will be, the testing will be collected by the Walmart site, processed at a laboratory, and then those results will be reported to the state health department, and then they will funnel those back to the individual's county of residence for local health department to act on. And
do you see, I guess, any adjustment of hours as I guess the site becomes more, publicized? Do you see any adjustment of hours or any adjustments kind of with the site in the future? And also, do you see additional sites as well?
Mm-hmm. They have told us they can scale the hours up. We're not sure what metric they're going to use to make that decision, Tyler. At this time, I'm unaware of any other retailer that will be offering testing, but I don't exclude that as a possibility.
Gotcha. And also, I was going to ask kind of what you all are, I guess, what has the response been so far? I know, it just was kind of publicized, I guess, more largely yesterday, but what has the response been at that site? I
don't know, Randy, any idea how many folks? It's their first first day of testing, so I would imagine their volume was light yesterday. Patients do have to pre-register, and that information is on our website. There's also an 800 number, I believe, that you can call to register if you don't have internet access. But you do have to pre-register, and then you can show up and be tested. We'll see what their metrics are, when they decide to open that. A lot of that is not under our control, and we will do the follow-up with the testing when the test results are available.
Good deal. And what all are you doing for like the homeless population here in Pitt County? Because I know a lot of the shelters have had to close. Is there anything or any organizations you all are working with for that population?
Mm-hmm. We do have eligibility for a FEMA grant to provide housing to certain homeless individuals with risk factors, although that funding may not be renewed. It was good through the 4th or the 6th of May, 6th. And then may be renewed for another 30 days. We're waiting to see on that. And some of those situations we may need to deal with on a case-by-case basis. But to date, we have not had a person discharged that needed to be isolated or someone else who's needed to be quarantined that was homeless.
Okay, and to wrap things up, is there any difference as far as the age range, the 2 to 78?
No, I think that's the 2 is still our youngest and 78 is still our oldest, Tyler.
All right, awesome. Thank you, Dr. Silvernail, for all of your insight. Appreciate it.
You're welcome.
Thank you, Dr. Silvernail.
Okay, have a good day, folks.
Okay, we will open up for questions for all of our other community and municipal partners that are also on the line. I'm going to go through the list right now of who we have available to speak to the media for questions, and then we'll go down the list of our media to see if there are any questions that they have. With us on the line, we also are here in person. We have County Manager Scott Elliott and Emergency Management Director Randy Gentry, and available virtually, we also have the Pitt Greenville Airport, the City of Greenville, Pitt Community College, Greenville Utilities, and the town of Ayden as well. So going through our media, starting with Elizabeth Johnson, the Daily Reflector, do you have any questions for any of our other partner agencies? Last once again, Daily Reflector, Elizabeth Johnson, any other questions for any of the other agencies or personnel here?
Yes, Pitt Community College.
Okay, Rick Owens, are you on the call still?
I am.
Okay, Jennifer, you go ahead with your, I'm sorry, Elizabeth, go ahead with the questions.
So do you have any students that are currently being trained, or I mean like healthcare, in the healthcare field right now, if that makes sense?
Our online classes.
Do I need to revert?
So our online classes had continued. They're wrapping up right now towards the end of the semester. And then, I mean, we'll go back with the similar protocols that we've had in place since all of this started, as far as we'll offer online what we can. And then once healthcare leaders and the state and everybody have given us a little bit of guidance, we'll continue working with our clinical sites on when we can get students back in.
Okay. So you don't have any students participating in clinicals right now?
Not that I'm aware of. I mean, it's,
okay.
So I mean, it's end of the semester right now. So exams were due, all of that fun stuff. So typically we would be having graduation tomorrow night.
And how many students are about to graduate and enter the nursing field right now?
I would have to pull that number. I'm not sure off the top of my head.
Okay, thank you.
Mm-hmm.
Okay, Elizabeth, did you have any questions for any of the other participants on the call?
Vidia isn't there, correct?
No.
Okay, thank you. Yeah, that was my last question.
Okay, and next up, WITN, Clayton Bauman. Clayton, do you have any other questions for any of the other participants on the call today?
No questions. Thank you.
Okay. WNCT, Madison Forsey, do you have any questions for any of the other participants on the call today?
Yeah, real quick, if Brock is still on the call, yesterday the Pitt County Commissioners had mentioned something about looking to the city of Greenville for maybe to make a rough plan about reopening. That was the first I had heard about the city of Greenville having a reopen plan. Brock, I don't know if city council's discussed it or what information you could share with us about that.
That has not been discussed.
Okay, just want to make sure. Thank you so much.
You're welcome.
Is that all the questions that you have further?
Yes, thank you.
All right, and Tyler Harden, WCTI, any questions for any of our other callers today?
I am good, Mike. Thank you.
All right, well, that wraps up today's media session. Our next media session will be on Thursday. That will, I believe, media session number 16 then. In the meantime, I want to remind everyone that there are 3 ways to provide or to obtain information on this. You can go to our website at pittcountync.gov/coronavirus, call the hotline at the health department, 252-902-2300. And you can also fill out an information request form at www.pittcountync.gov/COVID info. Thank you very much for attending.